Thanks for joining us on TVC Midday News. Conflicts between oil companies and their host communities have been a long-standing issue in Akwa Ibom State. But now the Commissioner of Police is calling for regular dialogue as a solution. Miriam Daniels reports.
CP Baba Azare says it's time for oil firms and local youths to sit down and talk. He believes regular engagement could help address the conflicts that have been holding back community development and economic growth in the state. To help fix this, he's instructed divisional police officers to work closely with youth leaders to find peaceful solutions to disputes.
So we just felt that as a command, we should have to bring the youth together to discuss these problems and admonish them to stop taking laws into their hands. At the same time, while we admonish the youth, we should also call on you, the stakeholders, that is the owners of these businesses in Akwa Ibom State, to admonish you, to talk to you, so that we'll be able to mediate as police officers between the host communities as well as the youth in those communities.
And when he addressed the oil company representatives, CP Mohammed Azari made it clear that closing the communication gap is key. He asked the companies to report incidents to the police early to keep things from blowing up.
So please, you know the dynamics of the problems and the challenges you are facing with the youth in those environments. So engaging the youth in dialogue and engaging them to educate them on what is right, what the companies can do and what they cannot do, I think will go a long way in solving these youth-related crises or problems in the state.
Mr. Justin Obo, security manager at Seplet Energy, voiced a major concern that the youths are being left out of the loop when it comes to implementing the Petroleum Industry Act. He explained that while the PIA requires oil firms to spend 3% of their operational costs on host communities, the actual issue lies with community leaders not involving the youth.
We are now saying that subsequently, we need to also invite those committee leadership to also let them understand that the youth is part of their responsibility to take care of, so that the company can have a enabling environment to operate and get their percentage ready at the end of the day. Thank you.
It is hoped that bridging these communication gaps could be the game changer in resolving these long-standing conflicts. Miriam Daniels, TVC News, Uyo, Akwa Ibom State.
A group of former Niger Delta agitators are asking for the repositioning of the Presidential Amnesty Program to meet its statutory mandate in line with the renewed hope agenda of the federal government. The Niger Delta Liberators and Ex-Agitators Forum is concerned over what it calls the leadership failing of the program at the time the federal government is implementing reforms that will enhance the economic prosperity of the country.
We want to thank President Bola Ahmed Tinubu, GCFR, for finding sons and daughters of the Niger Delta region viable for appointment into various sections of his government. We all acknowledge the interest of the President Bola Tinubu-led government in development of the Niger Delta region through release of funds for Niger Delta-oriented government parastatals like the Niger Delta Development Commission, NDDC, and the Presidential Amnesty Office. However, as a group, we cannot fold our hands and watch those who are supposed to be beacons of hope and pilots of the development in the Niger Delta region become our nightmares. Subsequently, we shall be leading peaceful protests to relevant offices after duly notifying all requisite security agencies. In light of the foregoing, we respectfully implore President Bola Ahmed Tinubu to cause a thorough investigation into the complaint lodged against Dr. Otuaro Dennis and his proteges.
Let's move to health matters. Now, the Coordinating Minister of Health and Social Welfare, Professor Ali Pate, says the federal government is unifying the public health structure to bridge funding gaps and secure essential medical supplies. The supplies are meant to serve citizens affected by HIV and AIDS, tuberculosis, and malaria across the nation. Professor Pate was speaking at the inaugural meeting of the AIDS, Tuberculosis, and Malaria Technical Working Group. The minister emphasized the importance of integrating sector-wide approaches to enhance healthcare delivery and ensure a seamless transition and sustainability plan across subsectors.
The last time we met alongside with the CCM ESCO, we agreed that the sector-wide program, the sector-wide policy and hope offered some opportunities for managing the transition as a consequence of the new U.S. government's policy on development assistance, and agreed that a technical working group under the SWAP governance that addresses HIV, TB, and malaria, which had previously been treated as standalone, because many of the funders of those programs were already committed outside government systems, so they were not brought in. But with the policy change, that we needed to make that adjustment and create a working group.
The Minister of State for Health and Social Welfare, Isiaq Salako, has revealed that plans have been finalized to establish and upgrade 6 federal teaching hospitals. Dr. Salako says this will be done with new radiotherapy and nuclear medicine facilities across the country, with 3 centers set to be commissioned in May 2025 and the rest before the 2026 World Cancer Day. TVC News' Kemi Balogun reports.
The World Cancer Day has been set aside to raise awareness about cancer prevention, detection and treatment, with a global push to reduce the impact of the disease. To beat cancer, these experts here say it will take combined efforts through raising awareness and improving prevention techniques through vaccination, early detection, prompt treatment and research.
While the vaccination for the viral hepatitis has been on the National Program on Immunization, HPV vaccination was commenced in 2023, and it is heartwarming to know that we have successfully immunized over 12 million girls for human papillomavirus, and effort is ongoing to improve on the successes recorded so far.
We should not focus just on treating the disease, but we should adopt perspective and experience of individuals, carers, families, and communities.
One of the major areas of disease management, including cancer care, is in the area of nuclear medicine services, which Nigeria lacks. But to change the tide, the ministry is now inaugurating a 35-member nuclear medicine technical working group to spearhead the management of cancers and other diseases.
That while our experiences and challenges may differ, our goal remains the same: ensuring equitable access to cancer prevention, early diagnosis, treatment, and care for all Nigerians.
As a country, we developed a very robust initiative, including partnering with the International Atomic Energy Agency, to develop nuclear medicine program in Nigeria. The National Nuclear Medicine Management Committee that was set up by the ministry in 2010 did their best and facilitated training of several nuclear medicine physicians and other allied health care professionals.
The Minister of State, as well as other experts here, agree that although the present administration has made substantial investment in cancer prevention and care within the last 18 months, a lot more still needs to be done to ensure that patients get the best treatment and are not burdened by the financial implications after a cancer diagnosis. Kemi Balogun, TVC News, Abuja.
Wife of the Kwara State Governor Olufolake Abdulrazak said that early detection of cancer remains the best measure to reduce its devastating impact on the people. Speaking at the World Cancer Day celebration in Ilorin, the state capital, Mrs. Abdulrazak called for improved sensitization and education for the killer disease. She said this will attract a higher survival rate and improved quality of life. A cancer survivor, Moyo Adegaya, appealed to governments at all levels to aid those with cancer due to high cost of treatment.
In 2020, Nigeria recorded approximately 125,000 new cases of cancer, with breast and prostate cancers the most prevalent cancers in women and men respectively. Dreadful as this may sound, cancer, when detected early as possible, there stands a chance of successful treatment. Early diagnosis improves cancer treatment outcomes by providing care at the earliest possible stage. This approach, however, is what is being adopted in Kwara State, amplifying sensitization of our people on the need to present themselves for periodic screening to ascertain their health status.
I think the message I will have for anybody diagnosed with any form of cancer is to take the standard care that is given. For most cancers, it's surgery and chemotherapy. Some will have to do radiotherapy. So I think that should be done first. We should not be afraid of hearing chemo and feeling once you hear cancer, you are dead, or if you take chemo, you are dead.
We'll take a quick break and return with more on the news. Stay tuned.